Imagine this hidden spot right in the middle of the chest. It's like a central station holding the heart, big blood vessels, the windpipe, the esophagus, all absolutely crucial stuff.
Mm-hmm.
Now, what if that normally safe space gets inflamed, turns into, well, sort of battleground inside?
Right.
Today on the deep dive, we're really getting into this area, the mediastinum, in our pets and looking at a condition called mediastinitis.
Exactly. And the mediastinum, it's that central divider in the chest. You got the breastbone, the sternum at the front,
Okay.
the spine at the back. Above is the chest opening. Below is the diaphragm, that big muscle for breathing.
Right.
And on the sides, you have these membranes, the mediastinal pleura, separating it from each lung.
Mm-hmm.
Its main job is, like you said, holding those key organs and keeping the lungs separate.
Okay, so this central zone, packed with important bits, usually keeping the lungs apart, it can get inflamed. What actually happens when it does?
So when that inflammation hits, that's what we call mediastinitis. It's usually kicked off by an infection, typically bacteria or sometimes fungi. And we see it kind of show up in two ways. There's acute mediastinitis that comes on fast,
Right.
and then chronic mediastinitis, which, develops more slowly. Both are pretty serious, definitely need attention.
Why is that? What makes inflammation right there in the middle of everything so worrying?
Well, it's all about location, 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 right? And what's in there.
Mm-hmm.
Because it's so central and holds all these vital things, problems there can have knock-on effects.
Makes sense.
Acute mediastinitis, the fast kind, can actually be life-threatening. The infection can spread really quickly, maybe even in the space around the lungs. That causes pleural effusion.
Which is fluid buildup?
Yeah, fluid buildup makes it hard to breathe.
Mm-hmm.
And there's also the risk of sepsis. That's a really severe body-wide reaction to the infection.
Oh, wow.
And with the chronic type, you might get these things called granulomas, like lumps of inflammatory tissue, or even abscesses, pockets of infection. And these can physically squeeze those big blood vessels, like the cranial vena cava. That's the main vein bringing blood back from the head and front legs.
Yeah.
Squeezing that really impacts blood flow.
So it's definitely not just a small local problem. The way this central hub is set up means trouble there can spread out and affect, well, critical systems pretty quickly. So for you listening, understanding this spot and how it can get inflamed is really key to spotting when an animal might be in serious trouble and why getting to the vet fast is just so crucial.
Precisely. And what's kind of interesting, despite how severe it sounds,
Yeah.
mediastinitis is actually pretty rare in dogs and cats.
Rare, but really serious. That
Oof.
definitely gets your attention. Okay, so even if it's uncommon, we need to know what to look for. What are those first signs, the things that might hint something's wrong there?
Yeah, the early signs can be a bit vague, actually. You might just notice your pet seems really tired, maybe weaker than usual, just off.
Okay, general stuff.
Exactly.
Yeah.
But as it gets worse, more specific signs usually pop up, things that should definitely make you worry.
Like what? What specifically should we be watching for?
Difficulty swallowing is a big one. Dysphagia. You might see them trying to eat but struggling, or maybe regurgitating, that's food coming back up soon after swallowing, but without the heaving you see with vomiting.
Okay, regurgitation, not vomiting. Got it.
Right. Another really concerning sign is swelling, often in the head, neck, maybe even the front legs.
Swelling, why there?
Well, it happens because that inflammation, or maybe compression from an abscess, in the mediastinum messes with the blood flow returning through those major veins from the upper body.
Ah, okay, that makes sense. Sounds pretty alarming, though. What about breathing? Any changes there to look out for?
Oh, absolutely. You might see rapid breathing polypnea, we call it.
Mm-hmm.
Or they might just look like they're working really hard to breathe, showing distress, maybe even sounding like their breathing is blocked somehow. A cough can show up too. And, of course, if there's a fever, that's always a general sign pointing towards infection.
So starts vague, maybe just lethargy, but can ramp up to trouble swallowing, that upper body swelling, breathing issues. Okay, so what actually makes this inflammation start in the first place? What are the root causes, the risk factors?
It helps to think about it in two buckets.
Yeah.
Acute and chronic causes.
Okay, yeah.
Acute cases, the sudden ones, are usually linked to some kind of direct injury, a breach, basically, in one of the structures inside or near the mediastinum.
Can you give us some examples of those injuries?
Sure. A tear in the esophagus, the food pipe, that's esophageal perforation. That's a major cause of acute mediastinitis.
Right.
Same idea with the tear in the trachea, the windpipe. That can do it too.
Okay.
Sometimes if an animal swallows something sharp, like a bone fragment or a stick,
Oh, no.
yeah, it can get stuck and actually migrate, poke through, causing inflammation and infection there. Even a wound, say, in the neck area, can sometimes track infection down into the mediastinum. And finally, abscesses, those pockets of pus, can form near or in the mediastinum, maybe because of another infection, or even sometimes tumors, and they can then trigger the mediastinitis.
Those all sound pretty dramatic, often like trauma is involved. What about the chronic cases? What's usually behind those slower burn infections?
Chronic mediastinitis typically involves specific kinds of bugs, bacteria or fungi that set up shop for the long haul.
Okay.
Certain bacteria like Actinomyces and Nocardia species, they're known culprits in chronic cases.
Right.
We also see fungal infections, things like coccidioids, cryptococcus, blastomyces, histoplasma. Those can cause it too.
And those are often geographic, right? Like valley fever with coccidioids.
Exactly. It depends where you are. And in some areas, there's even a parasite, Sclerocerca lupi, that can play a role.
Interesting. So acute is often trauma, a sudden breach. Chronic tends to be these specific infectious agents sticking around. Are there things that make an animal more likely to get this, even though it's rare?
Well, like we mentioned, swallowing foreign objects that get stuck in the esophagus is a big risk factor because they can cause that perforation.
Makes sense.
And really, any significant trauma to the neck or chest that could potentially damage the esophagus or trachea, that definitely bumps up the risk.
Okay, that tracks. So let's say a vet suspects mediastinitis based on the signs. How do they actually confirm it? What's the detective work involved?
It's often a process of ruling other things out first.
Yeah.
Things that can look similar. We call that differential diagnosis.
Right.
For instance, inflammation just around the heart sac, isolated pericarditis, can sometimes present similarly.
Okay.
We also need to think about pyothorax, that's pus in the chest cavity, but outside the mediastinum.
Gotcha.
And pneumonia, a lung infection, that needs to be considered too.
Are there other things within the chest specifically that could confuse the picture?
Yeah, definitely. Masses, like tumors in the upper part of the mediastinum, can cause similar signs.
Yeah, that kind of mass.
Things like lymphosarcoma, that's a type of cancer. Thymoma, a tumor of the thymus gland. Even tumors of the thyroid or parathyroid glands if they're in the chest, or nerve tumors, connective tissue tumors, even cysts sometimes.
Wow, lots of possibilities.
And we also have to think about problems with how the esophagus works, like motility issues where it doesn't squeeze properly, or a hiatal hernia where a bit of the stomach slides up into the chest. Even just general stomach problems causing reflux and vomiting could potentially confuse things.
It really sounds like peeling back layers to get to the answer. What about lab tests? What clues can blood work give?
A CBC, the complete blood count, is usually a starting point. With mediastinitis, we often see a high white blood cell count, and specifically something called a left shift.
What does left shift mean?
It basically means the bone marrow is kicking out lots of young, immature white blood cells. It's a sign the body's really ramping up its fight against an infection. Blood chemistry tests and urinalysis might also show things like a high PCV-packed cell volume and high total protein. That often just points towards dehydration, which is common when animals are sick.
And besides those standard tests, anything else specific on the lab front?
Well, depending on what else the vet suspects, they might run other tests to rule out those other conditions we talked about.
Right, the differential diagnoses. Okay, so labs give some clues. What about actually seeing inside? Imaging must be super important here.
Oh, hugely important. Chest x-rays, radiographs are often the first step.
And what do they show?
Frequently, with mediastinitis, you'll see the mediastinum itself looks wider than normal on the x-ray. That central space has a typical width, so widening suggests, inflammation, maybe fluid.
Okay.
You might also see the edges of the organs in there look kind of blurry or fuzzy. And sometimes you'll see signs of that pleural effusion, the fluid around the lungs, or even air in the chest cavity, pneumothorax, depending on what caused it.
You mentioned esophageal tears being a key cause. Can x-rays help spot those specifically?
They can, especially if we do a contrast study.
How does that work?
The animal swallows a special liquid, a contrast agent, that shows up really well on x-rays. Then we take pictures. If there's a tear in the esophagus, some of that contrast liquid might leak out, and we'd see it on the film.
Ah, clever.
Yeah, but it's really important to use a specific type, a water-soluble contrast, just in case there is a leak. We don't want other types leaking into the chest.
Good point. And what about fancier imaging, beyond regular x-rays?
Ultrasound of the chest can be really useful. It helps tell the difference between, say, a fluid-filled cyst and a pus-filled abscess in the mediastinum.
Okay.
It can also help assess how much inflammation there is, or maybe spot tumors. But for the absolute best, most detailed look,
CT scan.
yeah, a CT scan is often the gold standard. It gives those cross-sectional slices, like look through the chest layer by layer. Really helps to find the problem.
So blood tests, different kinds of imaging. Are there times you actually need to go in and get a sample to be sure?
Absolutely.
Yeah.
If there's fluid built up in the chest cavity, doing a thoracocentesis, basically putting a needle in to draw off some fluid, is key. We need to analyze that fluid.
Okay.
And if there's a mass in the mediastinum, obviously not the heart or a major vessel, we might do what's called a fine needle aspirate or even a biopsy, often using ultrasound to guide the needle right to the spot to get cells or tissue for analysis.
And what do you do with those fluid or tissue samples?
It's crucial to send them off for culture and sensitivity testing, both aerobic and anaerobic bacteria, the ones that need oxygen and the ones that don't.
Why both?
Because different bacteria might be involved, and we need to know which ones are there, and more importantly, which antibiotics will actually kill them.
Right, the sensitivity part.
Exactly. And if we suspect a fungus, we'll do fungal cultures too.
So it's often this combo approach.
Yeah.
Labs, imaging, maybe getting a direct sample to really nail down the cause. Okay, once you've confirmed it's mediastinitis, what's the game plan for treatment?
The main goals are, 1, tackle the infection with the right antibiotics or antifungals based on those culture results we just talked about.
Great.
And 2, if there are abscesses, they need to be dealt with, usually drained and cleaned out, a process called debridement.
And what kind of general care do these pets need while they're being treated? It sounds serious.
Oh, it is. Hospitalization is pretty much always needed, at least initially. And strict rest is important, cage rest, usually. Let the body heal.
Makes sense.
If there's a lot of fluid in the chest, or that pyothorax condition, we'll often need to place chest tubes.
Tubes in the chest.
Yeah, tube thoracotomy.
Yeah.
It allows us to continuously drain the fluid or pus out. In really tough cases, surgery might even be needed just to clean things out.
What about things like fluids and food?
Supportive care is vital.
Yeah.
IV fluids are usually essential to keep them hydrated and until they can eat properly on their own again.
Yeah.
We often need to provide nutrition support. Sometimes that's parenteral nutrition, nutrients straight into the bloodstream via IV, or maybe place an esophageal feeding tube so we can give liquid food directly into the stomach, bypassing the mouth, and potentially damaged esophagus.
You mentioned esophageal perforation earlier as a big cause of the acute cases. How does that change the treatment? Is it different?
Yeah, if there's a confirmed tear in the esophagus, that's usually considered a surgical emergency.
Ah, right. To stop the leak.
Exactly. Got to repair that tear quickly to prevent more contamination and infection spreading. And after that surgery, we definitely rely on that IV nutrition or maybe a stomach tube for feeding for several days to give the esophagus time to heal before trying food by mouth again.
And what about those chronic cases, the ones with abscesses or those granuloma lumps?
With chronic disease, yeah, surgery is often needed there too. An exploratory surgery to actually go in, find the abscess or granuloma, and remove or drain it.
Okay.
And that surgery is often followed by managing with chest tubes afterwards, again, to help drain anything left behind.
So the treatment really depends heavily on whether it's acute or chronic and the specific cause. Let's talk medications a bit more. What kinds of antibiotics or antifungals are we talking about?
For bacterial infections, we usually start broad. Broad-spectrum antibiotics that kill a wide range of bacteria, often given IV at first for a quick hit.
Right, while waiting for the culture results.
Exactly. Once those culture and sensitivity results come back, we can switch to a more targeted antibiotic, the one we know works best for the specific bacteria involved, and hopefully switch to pills, oral medication for the rest of the course.
Okay. And antifungals?
For fungal infections, yeah, we use specific antifungal drugs like itraconazole, fluconazole, sometimes amphotericin B. The key thing with antifungals is
Takes longer.
much longer. Treatment often needs to go on for 3 to 6 months, sometimes even longer.
Wow, that's a serious commitment. Okay, so treatment starts. What about follow-up? How closely do you need to watch these patients?
Very closely. Daily temperature checks are standard while they're hospitalized.
Okay.
Regular blood work, too. Especially checking those white blood cell counts. The hemograms maybe every 2 or 3 days during that initial hospital stay, which might be a week, 10 days, something like that.
And imaging. More x-rays.
Yep. Follow-up chest x-rays are important, usually maybe every 7 to 10 days initially, but more often if they still have chest tubes in for drainage. We need to see things improving.
And how long does the medication typically continue? You mentioned antifungals are long.
Yeah, antifungals are long. For antibiotics, the general rule is to continue for at least a week after the blood work looks normal and the x-rays look clear.
Okay.
But If there was an abscess involved, we usually need to go longer, often an extra 4 to 6 weeks of antibiotics after things look normal, just to be really sure we've wiped out the infection hiding in there.
So it's definitely an intensive process, treatment and monitoring. What are the potential roadblocks? What complications can pop up with mediastinitis?
Unfortunately, there are several possibilities. We've mentioned pyothorax already, the pus in the chest cavity. Sepsis is always a risk with severe infections, that dangerous whole-body inflammation.
Yeah, okay.
And a longer-term issue can be scarring within the mediastinum itself. We call that mediastinal fibrosis.
Scar tissue in that central hub. What does the overall outlook generally look like for pets diagnosed with this? What's the prognosis?
Overall, we tend to say the prognosis is guarded. It's serious, but if it's caught early and treated aggressively, really going after the underlying cause, the outcome can actually be fair to good.
That's hopeful.
It is. However, if that mediastinal fibrosis, that scarring, develops, then the long-term prognosis is usually more guarded to poor, unfortunately.
Why is the fibrosis so bad?
Because that scar tissue can cause ongoing problems. It can interfere with how the esophagus works, leading to long-term swallowing or motility issues. It can continue to compress those big blood vessels, the vena cava. It can even damage nerves that run through there, like the phrenic nerve controlling the diaphragm or the recurrent laryngeal nerve affecting the voice box.
So potential long-term consequences even after the infection is cleared if scarring occurs.
Okay, so wrapping up our deep dive on mediastinitis,
Yeah.
what are the absolute key things for listeners to take away?
I think the main point is mediastinitis, while thankfully rare, is really serious. It's inflammation in that critical central chest zone. Getting an accurate diagnosis quickly is vital. And then treatment needs to be aggressive, often lengthy, aimed right at the cause and managing any fallout.
And for you listening, it comes back to spotting those signs, the early, maybe subtle ones like just being tired or low energy,
Right.
but also those more specific flags like trouble swallowing or that swelling in the head and neck. Seeing those should definitely prompt a vet visit quickly. It really can make a difference.
Absolutely. And I know it makes you think, doesn't it, about how connected everything is inside. This whole discussion about the mediastinum, the central hub.
It really highlights the body's delicate balance. How messing things up in just one area can have such massive ripple effects on other vital systems. It kind of prompts you to consider other conditions too, ones that might seem localized.
Yeah.
And think about their potential for wider systemic impacts on our pets. Something to mull over, maybe.